Covishield poses no health risk and has no connection to the recent increase in heart attacks. In fact, it was the vaccine that saved millions of lives from the dreaded wave of COVID-19. Multiple experts have told News 18 after the pharmaceutical giant AstraZeneca recently admitted that their COVID-19 vaccine can cause a rare side effect of blood clotting and low platelet count after immunization. Experts clarified that the rare side effect occurs only during the initial few days of immunization and not thereafter, so there is no need to panic. Last week, AstraZeneca admitted in a legal document submitted to the High Court in London for a group action involving 51 claimants that its vaccine developed in collaboration with the University of Oxford to combat COVID-19 may lead to thrombosis with thrombocytopenia syndrome, also called TTS, in very rare cases. TTS is a rare blood disorder marked by abnormal clotting in small blood vessels. Let's understand how this syndrome affects human body. Now, as we know, AstraZeneca's vaccine was also produced by the Serum Institute of India's Covishield. Around 90% of the Indian population is vaccinated using the same vaccine. Discussing the latest controversies surrounding the AstraZeneca's admission, multiple doctors confirmed News 18 that there is no reason to panic. Doctors confirmed that this is not something new that has been revealed by the company now. In fact, this side effect was well documented after the vaccine rollout. The vaccine was rolled out because this risk was for just 7 to 8 people out of every 10 lakh people getting the vaccine. The benefits of the vaccine far outweigh the risks. We must understand that now it is not a concern for us as we had taken this vaccine a few years ago. Hear this out from Dr. Sudhir Kumar, head of the neurology department at Apollo Hospitals in Hyderabad.
Recently, AstraZeneca has accepted in the court that its vaccines had increased the risk of TTS, that is thrombosis with thrombocytopenia syndrome. So, in that, there is increased risk of clotting and also low platelet count. Now, what is important to note is that the cases of TTS they were very few and rare. It's a rare complication. Out of millions of doses, less than 100 cases were reported in the UK, European Union, and India also extremely rare. Other thing to note is that that complication of TTS usually occurred within say few days to up to 6 weeks after the vaccine doses. So in India, most people have taken the vaccine. Covishield is also one of the vaccines from the AstraZeneca group, which was manufactured in India by Serum Institute. And so that there is a fear and panic that many Indians could be also suffering from TTS and other clotting related complications now. But I would like to say that those complications occur within the 6 weeks of the last dose. In India, most people have taken the vaccine more than 2 years ago, and so as of today, in today's days, there is no increased risk of TTS or any clotting related complication due to the vaccine. And then there is a fear that there is increased risk of heart attacks and strokes, which are connected to the vaccine taken in the 2021 and 22. That also is not true because, as I said, the clotting related complications, number one, they are rare, and number two, they occur within the first 4 to 6 weeks after the vaccine dose. So, 2 years later, there is no additional risk of heart attacks or strokes related to the vaccines. Now we do see cases of strokes and heart attacks in all age groups, including younger population, and all of them we find additional risk factors, that is traditional risk factors of diabetes, hypertension, high cholesterol, sedentary lifestyle, smoking, alcohol, binges, and other traditional risk factors. So, in the end, I would like to say that the clotting related to AstraZeneca vaccine and other COVID vaccines, and also other non-COVID vaccines, also there is a real risk of clotting formation, but that is it's a very rare complication and occurs within the first few weeks up to the 6 weeks of the vaccine dose.
Also, doctors told us that the incidence of TTS appears to be higher amongst younger individuals and recipients of a first dose. The country's top epidemiologist, Dr. Raman Gangakhedkar, who was the face of Indian Council of Medical Research during government briefings on COVID-19, told News 18 that given the positive impact of this vaccine on millions of lives who are alive and kicking today, the associated risk is very rare and minimal. He said such a rare chance of damage exists even when you drive on the road in the form of an accident, and everything has some percentage of risk involved. Also, to clarify, there is no relationship between heart attacks and this COVID-19 vaccine and the admission of AstraZeneca about rare side effect. It has nothing to do with heart attacks. Let's understand this from Dr. Vikas Kumar Keshri from Narayan Hospital.
Recently, there has been a lot of panic due to the revelation that AstraZeneca vaccine, Covishield vaccine, can cause some rare complication, which is TTS. So, TTS is a rare disease which happens due to sudden clotting of blood in the blood vessels, small blood vessels. It is a very rare complication associated with AstraZeneca vaccine, and it is not a new revelation. WHO had given an update in 2021, and that followed it up by another update in 2023, where it was reported that some of the people who have received vaccines which has a vector from the chimpanzee, the adenovirus vector, can cause this rare complications. And this complication has been reported very rarely in one out of 7 crore people. And these symptoms of this complication are that you may have headache, you might have pain in the abdomen. If the blood clot occurs in the arteries of your heart, you might suffer a chest pain or a heart attack. Or if the blood clot occurs in the arteries of your brain, there might be weakness in the body parts or paralysis. But again, we want to say this is a very rare complication which has occurred in 1 in 7 crore people, and it happens in within first 3 to 4 weeks of vaccination. So those people who have received the vaccination at the peak of pandemic, they need not worry about this because the time period during which this complication occurs has already passed, and the vaccine has saved multiple lives because of its efficacy. And another question is that we are seeing a lot of reports of heart attacks or sudden cardiac deaths in young people, those who had no other diseases, in the social media recently. Is this associated with this COVID vaccine? So answer is no. ICMR has done a study in 20 states across the India, studied thousands of people and shortlisted around 730 people who suffered sudden cardiac death, and it was found that COVID disease itself was responsible for increased clotting activity in the body, and it was responsible for many of the death. In no study so far it has been found that these increased incidence of sudden deaths are due to COVID vaccines. Another question is what should we do? Should we be worried? So answer is we should not be worried. We should encourage healthy lifestyle, and other factors which cause heart attack, those should be prevented.
Therefore, there is no need for alarm. We all are secure and have successfully overcome the daunting challenges posed by COVID-19.